So pleasure to be here. I'm the founder and CEO of Televu, Ryan Del Rami, and I'm going to walk you through our platform. If I can get the presentation. There we go. So what we focused on when we developed this platform is really a few things. The key element was how do we bring a tool forward that allows for faster clinical decision making? As we know, the outcome of the patients are dependent on that. And given the fact that we don't have specialists all around the world in every other corner, we need to rely on some different technologies to bring those expertise in. And we'll talk about that in a second. As we started deploying this technology, we realized that there's cost savings, there's efficiencies, and certainly patient satisfaction. And that's where we started to look into integrating with other technologies, which you'll see in a second. Now, there are different definitions for virtual care, telemedicine, digital health, telehealth, however you want to call it. But typically when people mention virtual care or telemedicine, it implies that there's an interaction digitally between the patient and the physician or the care provider. Now, what we've done is we've taken that one step further because there's no really interactive platform between the peers, so clinician to clinician, which could involve the patient at the end of the day as well. But we'll show you how that works with our platform. So if the patient is involved, that's a simple application, much like a Zoom call or whatnot, or any type of cell phone-based application. You get connected with your physician, you talk to them. There are multiple other scenarios where the patient is in the clinical setting where you have handheld devices involved, there's tablets, there's phones, and somebody's involved in pointing the tablet to the patient or whatnot. In any case, there's some level of digital communication. Now, there are more advanced sort of tools that are installation-based or cameras that are installed in the procedure rooms, or there's robots that can walk around the hospital and bring the physician to the patient bedside, which are very expensive and sometimes awkward. But how do we kind of combine all these sort of platforms together? And over the last couple of days, we've heard of other speakers about having multiple platforms to deal with, and it's really hard to manage all those different platforms. One for the patient, one for this application, one for that application. So what we're trying to do is build that ecosystem that brings all this together in one place, so it doesn't matter in which specialty and who is involved in the care of the patient, they all can communicate effectively. So let's look at the communication flow. So we put the Televu cloud in the middle. And we got the frontline users and the remote users or remote experts connected through the cloud. Now, what do the frontline users need? They need some form of a communication device. It could be a handheld device that they could have, or they could own, or they could be provided for. It could be wearable technology. This could be AR glasses, XR glasses, or multiple type of other wearables. It could be medical monitors in healthcare setting. It's not just the visual effects of looking at a patient, or there are other screens such as vital signs, x-rays, endoscopy, fluoroscopy, any type of other medical imaging. And certainly different cameras, whether they're mounted or they're portable cameras, you could bring those into the call. Now, on the other side of the line, that's where the remote experts sit. You could have one or a collective group of experts connect to those frontline users. So it's a very fluid and very flexible platform that you can go back and forth between the frontline users and the remote experts. Now, how do you start a call in such a complex platform? It's very simple. Like, what we focused on is simplicity, to the fact that we know patient care providers are focused on the patient. They should not be worrying about technology. So it has to be a plug and play, simple use case. So you start a call much like you're all familiar with starting a Zoom call or a Teams call or whatever else you use, WebEx. So you call the other user simply by clicking a button. You could also have the user call the device, whether it's a handheld device or a wearable device. So that's another click of a button there. The devices can also call the remote expert, so it doesn't have to be one way or the other. It's a very sort of two-way communication platform. Either way, however you get into a call, now you have the flexibility to add other users, other devices, whether wearable or handheld, other medical screens, other cameras, and they all interact with each other. And these are all simply by a click of a button. There's no need to be going through a flow of work to get this done. Now, once you're connected, what then? You can have a one-to-one communication. So the person wearing the technology or holding the technology can communicate back with the remote expert. You could go one step further because sometimes that person might not have all the answers, so you bring in another person into the call, or a third and a fourth. We don't limit how many people can join the call. It's really a matter of bandwidth. You could also have multiple devices communicate with one expert. So in that sense, so you might have handheld devices, wearable devices. A good example of that would be in the OR setting where the scrub nurse might have a wearable device and the surgeon might have a wearable device, and they both connect to the remote expert. And last but not least, you can broadcast what you're doing for training purposes and conferences and whatnot, and share your experience from your point of view and other sort of views in the room to a larger audience. So as you can see, the connectivity is seamless. Once you're connected, there's lots of options to get communicating with the others. So let me focus a little bit on the wearable technology, which is a key element of this. The reason we selected or chose smart glasses, the AR glasses that we chose, is we simply want the eyes to be unblocked. Because if you're dealing with a patient, you don't want your eyes to be blocked. There's some models of glasses that have shade in front of you, which is not going to be as effective. So this is an unblocked vision of your eyes. The heads-up display here is going to be where the eyes are looking at. That, when you look at it, appears to be like a 6 or 7-inch tablet. And obviously you have the camera and the audio is going through the glasses as well. So in essence, you have your phone, you have your camera, you have your tablet, all in one, on your face, and your hands are free. So it's a perfect use of form factor for medical use cases. So as you can imagine, the person wearing the glasses looks at a patient, an object, or a screen, and that image gets securely transmitted to any device anywhere in the world. So the remote expert could be on their phone, could be on their tablet, could be on a computer, and regardless of their operating system, they can still connect. Now here's an example of a paramedic wearing the glasses. So what they're looking at with their eyes is going to be reflected on the heads-up display of the glasses. So they know what they're streaming. So that's an important factor because obviously they have to communicate with the other person. This goes through our cloud securely. It's a HIPAA compliant and ISO standard cloud. And on the other end, like I said, the remote expert on any device, they can visualize what this person is seeing from their point of vision. It doesn't stop there. Our augmented reality sort of functionality allows you to, for example, draw on the screen, point on the screen, superimpose 3D objects. For example, we did a customized dressing sort of database for a wound care program that they would have the various dressings and they can virtually place it on the patient's body so the other person can follow the instructions. So lots of different ways you could use the augmented reality in this case. So this platform is a web-based platform for the remote expert. You can log in with your organizational login credentials, so it doesn't have to be a new login. And this part is an app which is residing on the glasses. So once you get the glasses, it's pre-installed. So Televu I see and the Televu you see. The platform is pretty self-explanatory. I see what you see. It doesn't stop at the ambulance or transportation of the patient. It could be home care, long-term care, surgical settings, any type of emergency room, any type of inpatient, outpatient clinic. The possibilities are many. I just want to quickly draw your attention to a couple other things, because smart glasses are great because it provides a point of vision feed. But if you're in a clinical setting, in this case, an interventional lab, in this case, an imaging lab, there's more information available. You got the screens in front of you, and those screens bring a lot of information back to the remote expert. And simply asking this person or that person to look at the screen with the glasses is not going to be enough. We want to have a direct feed of these screens back to Televu, which we could with the screen view technology. And then if there are any cameras in the room, whether pre-installed or we provide as an add-on, those feeds can be brought back to Televu as well. So here's an example of the feed from the glasses, very clear HD image from a point of vision of a surgeon or an operator. Here's an example of the cam view installed on this one, this simple model. It can be installed on any IV pole. It's really easy to manage, or you could have fancy cameras that are installed or we install for you. And screen view, you get any medical screen back to the platform and you can have direct feed. And the best of all is you can interact with any of these screens using our augmented reality functionality. It's not just limited to the glasses. You can actually draw on the screen that is in the room and the operator is going to see it on the heads-up display of the glasses. So it's as if you were in the room looking over the shoulder, just pointing on the screen if you were in the room with them. Now, very important when it comes to video technology, it's privacy and security functionality. So if you look at this image a little bit closer, you can see the patient's face is blurred. So this is a patient undergoing a TE procedure. And our AI algorithm in the background is going to identify any faces in the video and blur the faces. So there's no personalized information on the video. Just as important on the screens that we transmit, again, our AI algorithm identifies the names and the MRNs and any type of PHI and blurs that as well. So when you're transmitting the information over security, it's not only secure, it's private as well. So you're not transmitting information that you don't have to, meaning the patient name or other sort of elements. Now, there's other sort of AI applications that we've built in. So you saw some of the basic work on privacy, but you could actually run any workflow on the glasses, on the Televu enabled glasses, and we will be able to audit that for you. So when you started it, when you ended it, how long each step took, is there an element of training involved for a person using that sort of checklist or procedural instruction. You could do range of motion calculation by simply looking at a patient. This could be any person looking at it. We could do fall detection. We could do, in wound care applications, calculating the temperature of the wound, looking at the surface area of the wound, which is an important indication of improvement of wounds. And last but not least, you can actually look at positioning of medical sort of devices, in this case, pacemaker leads. In the atrium or ventricle, we can draw around that and say, okay, is this the right position? Is it in the apex? Is it in the septal wall, or wherever that may be? So there's lots of different ways we can enhance this sort of platform depending on the use case. Our guiding principle, as just to end my talk, is that we've been patient-centric. This is the first and foremost on our mind. It has to be easy to access. Obviously, if the technology is not accessible, it's no good. So we haven't designed this just for the Mayo Clinics. This is being used in Africa. This is being used in indigenous communities in Northern Canada. So it's a very accessible platform. It's easy to use. People learn about it and put it into to work within 30 minutes. And it's efficient and affordable and most importantly, scalable. And with that, we're hoping to target the aims of healthcare with this technology, and hopefully this is going to impact the lives of patients. Thank you very much.
Thank you, Ryan.
Absolutely.
Do we have any questions from the audience? We have time for one very quick question, if anyone in the live audience has any. Yep.
Great technology. I'm curious about your revenue model. How do you build revenue, and then in terms of the costs that you have?
Yep. So the revenue model is a full SaaS model. So we provide the hardware and the software as a package. So to the organizations using this. So depending on the use case, there are multiple ways we do it. So we have mentor-mentee relationships in this example, where the hospital is considered the mentee, would acquire the technology, and the mentors would join that platform to provide expertise to them. In the model of wound care that I may give you an example of, the regional health system would pay for that and spread it into the communities for those communities to have access to care. So either way, we get revenue based on SaaS. Who pays for it is different based on the use cases and different geographies, obviously. Sure.
So some of our use cases would be involving sterile environments. How do you kind of take care of that in terms of sterility that needs to be established, say, in an OR?
Yep, absolutely. So if you look at a lot of these devices, they're outside the sterile field, and the wearable technology is in the surgeon's head. And we see this every day. They wear headlamps, they wear glasses, they wear other type of sort of instrument on their head. And these devices are all IP66 or IP67, so they can easily be cleaned and disinfected and reused. It's UVC compatible. You can put it in UVC. It doesn't have to be sterile because it's outside the sterile field.
So these are not disposable for sure then?
They're not disposable for sure. The headbands, they're replaceable. The frames are replaceable. So those are personalized for each user. So you can have 10 headbands and one stick at the glass, and everybody has their own headband, so they don't share those type of personal equipment.
And sorry, one last one. The hardware involved is only the glasses, or is there anything else in the hardware?
No, it could be a smartphone, it could be a tablet, it could be PTZ cameras, it could be many different, we have a vital sign monitor that can be connected to this, so lots of different ways we can enhance that. And there's a thermal camera, which you saw images for the wound care. The thermal camera is actually part of a specialized smart glass as well.
Thanks.
No problem.
All right. Thank you very much, Ryan.